This video is going to be on pancreatitis and specifically the CBC and chemistry changes that we expect to see with pancreatitis. I'll talk more about the specific tests for pancreatitis in other videos. So pancreatitis is inflammation of the pancreas. So I'm going to draw a little angry face on this pancreas because it's inflamed. And when the pancreas becomes inflamed, it releases its digestive enzymes prematurely. So usually these enzymes are in an inactive state and then they get excreted into the duodenum to aid in digestion of food. But during times of pancreatitis, they're released into the pancreas and the peripancreatic areas. So the enzymes are released into the intra-abdominal cavity, which has lots of peritoneal fat, and it's released into the peritoneal cavity where there are also other organs, so specifically the liver. So first I'll stick with the digestion of the peritoneal fat. So those enzymes break down the fat into fatty acids, and I'll abbreviate that FA. So FA, fatty acids. And the calcium within the blood vessel binds to these fatty acids and leaves the blood vessel. So again, calcium binds the fatty acids, and then the calcium concentration lowers in the blood vessel, and again, binding fatty acids and lowering in the blood vessel. So pancreatitis is a cause of hypocalcemia. So when we see this calcium binding to fats within the abdominal cavity, we call this saponification of fat, which is also known as calcium soaps. Okay, so now going back to the digestive enzymes and those digestive enzymes affecting other organs within the abdominal cavity, specifically the liver. So it makes the liver unhappy and it induces liver injury. So the things that we look for in the blood are increases in our liver injury markers or our liver leakage enzymes. And those are ALT, which is more liver specific in small animals, and AST, which is less liver specific. So those that inflammation also releases lots of inflammatory cytokines, which makes its way into blood and eventually to the bone marrow. And the bone marrow releases lots and lots of white blood cells that get called to the pancreas and also into the peritoneal cavity because of there's a peritoneal inflammation. So we expect to see signs of inflammation on our CBC. So that's neutrophilia, greater than 2 times the upper reference interval, left shift, toxicity. Also, pancreatitis is one of our causes of a leukemoid response. So it can actually cause a marked neutrophilia, greater than 50,000 white cells per microliter. Okay, so the inflamed pancreas gets edematous and it kind of swells, and there's also swelling of the peripancreatic tissue, and this actually causes compression of the common bile duct, and this compression leads to backup of bile, which goes into the liver and also into the blood. So we look for evidence of cholestasis on our chemistry. So that is an increase in ALP, GGT, bilirubin, cholesterol, and bile acids. All of those can increase because of cholestasis. Now those bile acids can also digest the hepatocytes a little bit, so they have a detergent action on the cell membrane, so that can also cause liver injury as well. So we'll see increases in ALT and AST because of that. All right, so these animals often have vomiting, and that's again because of the inflammation within the abdominal cavity. So because of this vomiting, you can see loss of water, so the animal might be dehydrated. And there's also loss of electrolytes, and depending on which electrolytes are lost, you might see some sort of acid-base disorder as well. Okay, so the pancreas also releases digestive enzymes into its own tissue. So there's injury to cells of the pancreas, including the islet cells. And the islet cells are responsible for making insulin. So during times of acute pancreatitis, we often see a deficiency of insulin because the pancreas isn't making the normal amount that it should. Now, insulin is normally responsible for moving energy from the blood into cells. So remember, insulin in, energy in to cells. So if there's a deficiency of insulin, then you would expect to see increases in energy in blood. And that's exactly what we tend to see. We tend to see hyperglycemia, hypercholesterolemia, and hypertriglyceridemia, all because of this insulin deficiency. So that's pretty much it, the summary of acute pancreatitis in dogs and less commonly cats. We get wonderful cholestasis, hepatic injury, lots of inflammation, dehydration, electrolyte and acid-base disorders, hypocalcemia because of saponification of fat, and then increases in our energy in blood, glucose, cholesterol, and triglyceride. Now, not all of these changes occur all of the time, but certainly you do expect to see most of these changes in an animal with pancreatitis.